Hello.
Hi.
So I'm going to ask you about 40-year-old plus's eyes.
Eyes. Yes, you want to ask about eyes.
So here's what we talk about at reception and surrounding areas of the clinic
Yes.
is those rascal lines that go along here.
Yeah, okay. The fine ones underneath on
Yeah,
the
right
thin
under
skin.
here.
Yeah.
Now, you can't put filler there, can you?
No, the skin is really it's like it literally is like tissue paper. I know that sort of eye surgeons have always said that, but it was only a few years ago when I saw on a dissection, nice, but you actually see how thin that skin is. It is ridiculous. And you couldn't, it is like tissue paper is the best description of it. If you put anything behind that skin, it's going to stretch it, show through. Filler can attract a bit of water as well, so that will actually just push it through. So no, you can't fill right up there. You can fill in what's called the teardrop, feel that groove,
Yeah.
because you have solid bone underneath, so you can inject deep onto the bone. Sounds painful, doesn't it? But it's not. It's just the way, it's the
I've had it.
position the filler
Yeah.
should be, really deep down there. So you can still put filler down there. I say still because we'll move on, won't we, to what you've had there. For underneath those eyes, for the fine lines in that skin, no filler. But yes, we can use polynucleotides, can't we?
Okay. Because I've had those as well. Uh, Before we move on, um, Botox under
Okay.
the waterline.
So you can, okay, you can have Botox really superficially underneath in those skin. Again,
Just in this area.
just for those little fine lines that
Okay.
you're talking about, you can have it. However, we rarely do it. It's one of those things, like a lot of things in medical aesthetics, it's risk and benefit. The benefit is minimal because a lot of those lines, like I say, are not caused by the muscle. It's just the skin getting older, thinner, saggier. If the lines are caused by the muscle, so from scrunching like that, then
Okay.
Botox can work. But the effect is a bit minimal and the risk is high because underneath there, you have a muscle that controls your eyeball. If the Botox soaks into that muscle, you get double vision for a number of weeks. So you can't drive. Imagine having double vision for, you can't drive. You can't, it would, luckily, touch wood, it's never happened. But we warn everyone, and you go, that's your risk, which you don't have sort of anywhere else. And the benefit is you might get a little bit of softening on those very fine lines.
Would I
So,
see two of you?
yeah, exactly.
Oh,
Lucky old
no,
you.
the
Yes.
risk. The risk is too much. Um, okay. If you do have it underneath, is it a small dose or are you going to have the normal dose?
Tiny, tiny, tiny dose.
So you'd still need it quite a lot.
Yeah, exactly, because it's going to wear off quicker. So it wears off quicker because it's a tiny dose. A big dose, this is all Botox, a big dose of toxin will spread a little bit more. And
Um,
that's the last thing you want there. It's got to be precise. And so tiny doses. I mean, that's what happens on the lower face. On the lower face, because the muscles are more interweaving, you only want lower doses down here because say you're stopping this muscle down here, pulling down. If it's spread a little bit, then it will affect the lip. It can affect the smile. It can affect
right.
speech.
Okay.
The lower dose tends to spread less, so it can be more precise, but it will wear off a bit quicker. But that's just the life of Botox.
Okay. Back to eyes
Yeah,
then. So no filler directly under
yeah,
the water, thinness of
yeah,
skin. You can have Botox. There's a risk.
yeah. Big risk.
So now,
We have polynucleotides, don't we? So polynucleotides are, I hate that fish sperm, that salmon sperm,
or trout.
trout sperm. It makes it sound all. It's that's what that. I'm only saying that so people know what we're talking about because they'll have seen that on Instagram, haven't they? This salmon sperm facial. It is fragments of fish DNA, and again, you can forget that. That's not vital. But basically, what it does is polynucleotides stimulate your own skin cells to produce collagen in a nutshell. They also reduce inflammation, but that's not really where you're having it there. So if you're going to get more collagen produced, the skin gets a bit tighter, and that's how you get those fine lines gone. There's no risk of double vision. There's no risk of overfilling. They don't attract water. Okay, when you've had the injections, they swell for a day or so from the water and from the injections. But for the long term, there's none of those risks that you have with filler or Botox. So
Because
it's
it's a
brilliant stuff for
different
that. Completely
molecule.
different mechanism of working.
Okay.
Exactly. Gets into the cell, tells the cells to produce more collagen. Cells produce more collagen. So you will have a course of them. You'll have one, and then a few weeks later have another. You have about a course of 3, spread about 4 weeks apart. That's the way to stimulate your cells to.
Why 3?
That's just really what's been found to work. That's what the manufacturers recommend. You can have more. If you only have one, you're not really going to see. It's not
No.
enough. If you have 4 or 5, great. The results are even better. It comes down to cost, really. You can't overdose on them like with filler or Botox. We go too frozen or too full. Doesn't really happen with the polynucleotides.
So actually, if you had quite a lot, if you have them every month, you're saying it gets better.
Yeah, 100%. And you can have them all over your face. There's a brilliant one combined with hyaluronic acid. So hyaluronic acid is filler, or when hyaluronic acid is very runny, like honey, we call it more of a skin booster because it
Right. Okay.
hydrates the skin. So there's a brilliant combination injection now, which is polynucleotides. So that's going to be the long-term stimulation of collagen. And that is combined with the hyaluronic acid to give you that short-term hydration. So that's a really lovely skin booster for all over the
So you
face.
wouldn't use that under your eyes then, do you?
No, because the hyaluronic acid gets back to that sort of
Yeah.
filler problem, attracting water and too
Okay.
much swelling. So no, pure polynucleotides here, and then here you can
And
use the
so,
mixture.
do the polynucleotides do hollows? Because
Yes,
that's another
they do.
area that seems to hit us.
They do. The skin will get thicker, and also the polynucleotides have been found to produce a bit more fat as well when you want to. When you go a little bit deeper, they will stimulate the fat cells. So it tends to thicken up that layer, and it does help with tear troughs.
The other issue that the over 40s seem to have, we have a list,
We do, I know.
is dark circles.
Okay,
Any
yeah.
help with that?
Yes. So dark circles for 2 reasons. One cause of dark circles is like getting back to the tissue being the skin being so
Okay.
thin, is that blood vessels and the muscle underneath show through grey blue. So literally the muscle shows through the skin. So if you can thicken up the skin with polynucleotides, you won't see the muscle as much. So that will help with that darkness. The second cause of dark circles is melanin, so your own natural pigmentation. This tends to be a problem that darker skinned people have because the melanin just overproduces here, can be genetic. Now, okay, it's not a direct indication. In other words, if you ask the manufacturers of polynucleotides, does it correct dark circles? Officially, they have to say no.
Okay.
But we have found anecdotally, I think, in our practice, haven't we,
Yep.
that ladies who have dark circles through the pigment are definitely seeing an improvement.
Yeah. I've seen it.
Yeah. So it does improve for both things.
Okay. Now, it can hurt.
Yeah. Well, yeah. Okay. Yes. Okay. Yes, it can. It's a tender area. Okay. It's a tender area underneath the eyes.
Okay.
Now, also, the polynucleotides are a different pH. Not got too technical with that. Like, I know the pH is whether it's acidic or not. So it's slightly different to the skin.
Okay.
So, in other words, you get that tingle when the polynucleotides interact with the skin. It is a tingle. It's a light sting. However, what we found is that numbing cream works brilliantly well. Again, the polynucleotides is put in by a few little, it's a sprinkling of tiny, they're not deep at all, it can't go deep. It's really, really superficial little injections, which can nip and can bruise because it's just a load of little tiny, tiny injections. So the numbing cream really reduces the pain almost down to nothing and really reduces the bruising as well because the numbing cream actually helps constrict the blood vessels. They shrink a little bit
Okay.
temporarily so that when you go in with your needle and stuff like that, you're going to get less bruising. So definitely we'll get our patients in half an hour beforehand for the numbing cream to reduce bruising and pain. So yeah, that should help, shouldn't it?
I love it. And if you have your three under your eyes over 3 months, then when do you suggest? Aren't you meant to have a booster? Is that six
Yeah,
months or
4 to 6 months after,
four to
and so
six
say
months?
maybe every sort of 6 months. I think most of our patients like a 6 monthly booster.
You just
You have your
having
three, yeah, you have your three, and then you have one just every 6 months, don't you? Yeah. Yeah, it's going down really, really well, isn't it? It's not like a new invention. It has been around for years, but it's just gaining traction now. I like everything. I am risk averse. I won't try anything. Well, I'll try it on you first, and then we can roll it out to the patients once we know it's okay. But I don't jump on a bandwagon, do I? I like to know it's been around, it's tried, it's tested, it's scientifically proven, and then we're good to go. And that's exactly where we are with polynucleotides now.
No, I think you're right. I think because you've proved it because you've so old. You've learnt in the past that some people have used some fillers too quickly.
They have. We were
And
guilty of that. Not guilty. I say guilty. We didn't use the stuff, but well,
don't
okay.
we all of a
Well,
sudden?
all right. I remember we got that stuff. Just used it on your friend. I forget what it was called. It was an old
You
back
don't
in the
need to
day. It
know.
was collagen filler. It just wasn't the one, was it? It just wasn't smooth enough. So I ended up throwing it away. I couldn't put it in anybody else. She was game for it. Jane will have anything. Good old Jane. She's out there. But we threw it away after that because it didn't last. It wasn't that smooth. You couldn't justify sticking that in anyone. So then that was a couple of thousand I
Except
threw in the
Shane.
bin. Except Jane. She'd have had it out of the bin.